Okay, now we're recording, and I'm gonna go back and share the screen. Okay, so if you do have some sort of a technical problem, then go ahead and text the BLS GroupMe, or you can text me at 219-742-2803, and then I'll pause, and we'll see if we can get that fixed. Okay. I will, so I'm going to go ahead and get started. Everybody is muted. So I'm going to go through this presentation. Like I said, if you have questions at the end, I will unmute everybody and you can ask them, or you can type them in the chat box, and then I will just read the chat box at the end and then answer those questions. So I want to do this presentation to give you guys some information about COVID-19 and BLS's safety protocol in preparation for opening up. See, there we go. Okay, so some of these things I'm going to go through pretty quickly. Other things I will go through more slowly. Sorry, I'm going to admit one person. Okay, I'm going to pause for just a minute and make sure we have everybody here. Okay. If anybody is having trouble, then send a message to the GroupMe. It looks like everybody's on. Okay, so coronavirus was first reported in Wuhan, China, and the virus it's particularly dangerous because there's no known pre-immunity and no vaccine at present. There's no specific treatment that will cure it, but there are treatments that will help often. So the virus is contagious, and everybody is presumed to be susceptible. The coronavirus is a large family of viruses, most of which are harmless to humans. Sorry. On February 18, the World Health Organization named it the disease that you get from coronavirus, COVID-19. And both the virus and the disease were unknown before that. It has now spread worldwide. Sorry, I have to admit somebody. Okay. The virus can spread from person to person, including by people who appear to have no symptoms. So people can catch it by touching objects or surfaces that are contaminated with the virus, by touching their eyes, nose, mouth after that, but that is not the main mode of transmission. So people also can be infected if they breathe in droplets from another person who has the coronavirus, who coughs or exhales out the droplets. And droplet inhalation seems to be the main mode of transition. So you're more likely to catch it from people you spend a significant amount of time around. And this is one of the reasons why it's important to be in smaller groups. How dangerous is it? So the latest estimates are that 80% of people who get it will experience a mild or moderate form of the disease. Roughly 15% of the people who get it will develop a more severe form of the disease and require hospitalization, and some 5% of people who get it will become infected and become critically ill. COVID-19 is more dangerous for elderly people or people suffering from infections, other ailments. So far, children seem to be less affected by it. So how can I prevent myself from being infected? So, of course, good hand washing techniques. I'm sure you've heard that ad nauseum. Sorry, I'm going to check the text here. Caitlin, can you text me to let me know that you have gotten on? And if anybody else is having trouble? Okay. Okay, I'm going to go ahead and keep going, but all right, good. All right, so hand washing is really important. Use enough soap, use hot water, make sure all parts of your hands are washed well. You've heard spend 20 seconds washing your hands. If there's no visible dirt on your hands, using alcohol-based gel is a good option. Do your best to avoid touching your face, certainly not your eyes, nose, and mouth. And that's one of the things that is a benefit of wearing a face mask or a face shield or both, is that you will not be able to touch your eyes, nose, and mouth, especially if you have a face shield on. Social distancing is advised whenever possible, and you should avoid crowded places and large gatherings. And generally, keep some physical distance between you and other people, especially when you are in larger groups. So if you can't social distance, what can you do to protect yourself? So wear a face mask. It's a good idea to potentially wear a face shield as well. I'll talk more about that in a little bit. Ask others around you to wear a face mask. In a polite way. You can't walk up to a stranger in the grocery store, but you can social distance from them. But you could ask people well to wear a face mask. Encourage others around you to wear a face shield if they can't tolerate a face mask. Prompt others, like children and clients, to cover their nose and mouth for sneezes by modeling an elbow sneeze. You can hand over hand them if you see it coming. You can turn them. I didn't put that in here, but you can turn their shoulders to face another way. Even if they're wearing a mask, you want to try to get them to do that. I'll talk more about this in a little bit. Prompt children and others to wash their hands frequently. So once an hour is a good rule. Prompt children and others to use hand sanitizers after coughing, sneezing, touching their own mouth, nose, and eyes if they can't wash their hands. And space yourself as far as you can away from people in a room when possible. So how can I protect others? So, monitor how you feel. Do you have a temperature? Do you have a cough? Do you have body aches, in your joints, hips, wrists, elbows, knees? Are you having difficulty taking breaths? Does it hurt to breathe? If you have any of those symptoms, don't go out in public, don't go to work, call your doctor for advice. So, use proper cough and sneeze etiquette. So I talked a little bit about that, trying to get children and clients to do it. You can cough into the crook of your arm and your elbow, hold your arm tightly to your mouth and nose and turn away from others, even if you have a face mask on over your mouth and nose. And then, if you do have a face mask on and you sneeze in that manner, you could take tissue and put it over your face mask and sneeze into that, or pull on your face mask after turning away, tissue, sneeze into that. Either way, I would recommend changing your face mask and washing your hands or using hand sanitizer after that. How else can I protect others while returning to my life? So keep the number of people in general in your life that you have close contact with to a minimum. Stay in smaller groups. Social distance and wear a face mask if you have to communicate with somebody outside of your group. And when you spend time in community spaces, sanitize what you touched when you're done. Obviously wash your hands after leaving that space, and then keep the number of people in a community space to a set number to reduce crowding. Continue to diligently wash your hands, follow the washing hands protocols, sneeze covering, cough covering, etc. So as far as what our state recommends, Indiana's governor created a plan to systematically remove restrictions called Back on Track Indiana. I'm going to go through this. This plan involves slowly removing restrictions and consists of 5 stages. So stage 1, already through that one. Some medical procedures are allowed, some businesses allowed to open at reduced capacity, curbside pickup at other stores, state parks open, golf courses open, social gatherings of up to 10 people allowed, face coverings recommended. Stage 2, some travel restrictions lifted, religious services allowed to convene, more businesses open, BMVs and libraries open, social gatherings of up to 25 people allowed, face coverings recommended. And then stage 3, which is where we are now, Lake County was 1 week behind the rest of the state. All travel restrictions are lifted. Social gatherings of up to 100 people are allowed. All those other things that were already in place. And then beginning on June 14th for most of Indiana and June 21st for Lake County, Indiana, retail stores and malls will be allowed to be at full capacity. So no restrictions on the number of people that are coming in. Professional office buildings will be allowed to be at full capacity. Restaurants at 75% capacity. Bars and nightclubs at 50% capacity. Movie theaters, bowling alleys at 50% capacity. Playgrounds to be determined. And then beginning on July 4th for most of Indiana, July 11th for Lake County, retail stores, malls, again, full capacity, bars and restaurants, full capacity, youth events, sporting events allowed, everything at full capacity. So what BLS has been looking at. So while BLS is using that Indiana's plan as a reference, we are using the data on COVID-19 as more of a reference, and particularly in Lake County, Indiana, because that's where BLS is located. And that is the highest, Lake County has higher rates than the counties around it. So it's a good guide for us. We've been charting the number of positives per day in Lake County and the percentage of total tests that are positive. So we're looking at the number of positives, but also the percentage of total tests that result in a positive. So I'm going to come back to that. We have graphs in here in a little bit. The number of positives began decreasing the week of April 26th, showed a slight downward trend for about 2 weeks, and sort of leveled out. I mean, you could maybe interpret a little bit of a downward trend, but kind of leveled out. But the number of tests has gone up significantly. So the number of positives is positive tests are going to go up a little bit, or at least maybe not decrease, because the number of tests, people being tested has increased. But if you look at the number of positives is showing a slight downward trend, despite it's very slight, but a downward trend besides the number of tests increasing. So it's somewhere, the tests were close to 1,000 on a day or two, and I'll get to that chart because I don't remember the exact numbers, but average somewhere between 500 and 600 a day mostly. The number of positives hasn't changed much despite that jump in tests per day. So this is, so in other words, more people get tested. As more people get tested, fewer of that bigger number are testing positive and getting positive results. So this chart shows the percentage of tests in Lake County that are positive. So the top part of the chart up here, that is the percentage of total tests that are positive. Oops. And the bottom part of the chart shows the increasing trend in total tests. So you can see over here, there were a few days up around 1,000, and somewhere between 500 and 1,000. Mostly there was a little drop in number of tests here, which is why the percentage went up, because there was a drop in number of tests. So, so this is a downward trend, which is good. That's what we want to see. Here's another picture. This is the percentage of the population in Lake County that is tested positive. So you can see that the percentage is not increasing. It may have a slight downward trend, which means there's no significant increase and the curve is flattened. So what was needed to determine we are ready to open? So we needed to see an extended decreasing trend in positives. So we have that now. There must be testing for everyone who needs it. And we have that now. There must be contact tracing, so the ability to track everyone exposed for all individuals who test positive. I'm told we have that now. And there must be hospital space and ventilators for those who need them, and we do have those things. So, I guess the question is, will you stay locked in your house all alone, and can you, and are you? So there will continue to be transmission of the virus through society. That was never going to stop. It's not possible to eliminate the virus. It's in society, it's worldwide. There's no way to get rid of it now. And it's always going to be a concern. We'll talk more about vaccines and that kind of thing. The goal of the shutdown was to decrease the rate of spread, so like flatten the curve, because, as it's going up, then it's like, you guys are too young to remember the commercial. There was a shampoo commercial, and it's like, I told 2 friends and they told 2 friends, and they wanted to stop that escalating rate of transmission. So we do have, you know, at least in our area and a lot of areas, a flattening of the curve, but it's not possible to get rid of it. So healthy members of society can now begin to go out to places outside of their home, and many people already are no longer quarantining and have begun socializing and shopping and that kind of thing. So, you know, our clients need therapy. They've been home with their families, and the world is opening up around them and their families. So, you know, we have to get back to helping them. So what BLS is going to do is we're going to provide face masks. They're going to be mandatory for every employee. That's the face mask that you wear over your nose and mouth. We have the standard, you know, kind where it's got a little piece of metal in there. You crimp it on your nose, you know, goes over your ears. We will allow you to bring your own cloth masks if you wish to do that, and wear those instead. We will be providing face shields for therapists. These are optional, so you can wear them if you want. This is the example of one of them. We have two kinds. One is like this example where they have like these little plastic glasses and the shield is attached to those. And so they're less likely to fog up. But we also have another kind that has like sponge that goes around rests on your forehead. The shield is attached to that, and it's just like a headband. Whatever's more comfortable for you. If you want to wear a face mask like that, a face shield, then you can. You don't have to. You can bring, we can maybe try to provide goggles if someone would rather have that. I just haven't found any yet that looked good. We are going to encourage learners to wear face shields. I can't guarantee that we'll be able to get them to wear it, and we are going to encourage learners to wear face masks over the nose and mouth, and we can desensitize them to that if possible, but I can't guarantee that we'll be able to get them to wear those. So I wanted to add, you know, more protection in the form of face shields. BLS will promptly identify and isolate potentially infectious individuals. So every person must answer a brief questionnaire and have his or her temperature scanned prior to entering. Employees will be questioned and scanned at the door. Clients will be scanned in their cars or just outside their cars. We'll continue the same pickup policy that we had before. Only clients will be scanned. I'll talk more about who's going to do the scanning, and not their entire family, because we won't have the time to go scan everybody in the family. Just clients will be scanned. Parents of the learners will be questioned in their car about their child, about their family, so we'll ask them questions. And visitors will be minimized, and will be questioned and scanned in the hallway if they come in after open, before they're allowed entry. If a client is discovered after being at the clinic, if a client is discovered to have a fever, if they're discovered to have a fever or some other symptom while they're there during the day, then they will be required to wear a mask if possible. They will isolate with, you know, one adult on their own if possible, as much as possible. But if someone needs to be with them, one adult, until a caregiver can pick them up. What's considered a fever? A temperature of 100.4 degrees or higher is considered a fever. A temperature of 100.3 degrees Fahrenheit or below will not prevent a person from entering. We will scan everybody's temperature with a touchless digital thermometer. I have 3 ordered. They're not here yet, but they'll be here soon. And if an individual registers a temperature of 100.4, like I said, they won't be allowed to enter. These are the questions that will be asked to people before they come in. This is the questionnaire. Also be asked to the families. And if anybody in the family answers in the affirmative for any of these, then we would not have their child come in. So do you have a new cough that you cannot attribute to another health condition? Are you experiencing new shortness of breath that you cannot attribute to another health condition? Do you have a new sore throat that you cannot attribute to another health condition? Like I have allergies. I have a little bit of an earache and a little bit of a sore throat because of the drainage. You know, so we will, you know, question that further if someone mentions that. But if you can't attribute it to another health condition, are you experiencing new muscle aches that you cannot attribute to another health condition, or might not that may have been caused by physical exercise or something? Have you had any person-to-person contact with someone who has exhibited COVID-19 symptoms in the last 10 days? Have you visited an area where there's been significant outbreak of COVID-19 in the last 10 days? Do you agree to abide by the company's safety protocol, hand washing, face mask, etc.? Requirements when at BLS. So all employees must come through the front door of Suite J, the main entrance with the blue awning, or through the back door of Suite J into the kitchen behind the gym. So all employees must be cleared by an employee screener. One will be located at both of those doors, and that will be starting at 8:25 a.m. approximately, maybe a little earlier. I might tweak that a little bit. Each employee must answer a series of questions and have his or her temperature scanned before being allowed to enter. A normal temperature, like I said, is 100.3 degrees Fahrenheit or less. All employees will clock in and out through ESS. No one will use the time clock. All employees and visitors must wear masks when in the building, and face shields or eye coverings are optional. When must I wear gloves? So gloves are optional in the building in general, but in gloves, I highly discourage wearing gloves at all times. However, if you prefer to wear gloves while working with a client, you have to change them frequently. So you must wash your hands at least once per hour. That's going to be part of our protocol. And you should change your gloves at that point or more often, depending on the activities that your learner is participating in. All employees should wear gloves in the bathroom when assisting a learner. And all employees must wear gloves when preparing a learner's food or snacks. So this is new, but you're gonna have to wear gloves when you're preparing someone's lunch or when you're making a snack for them. If you're assisting them, like you have to pick up something to help them take a bite, or you're assisting hand over handing them with a spoon, you should have gloves on. And also, if you're handing a learner a piece of candy, a piece of food or a piece of candy or something, you should wear a glove. Well, okay, I should have edited that, because if you're handing them a piece of food, like a cookie or something, you should have a glove on. But if you are not going to stay there and work with them at lunch and continue to help them in some way, you should then change your glove, and you should not do other things and then hand them more food if you've touched other things. So if an employee is wearing gloves, so just across the board, we are going to have a policy for if you're giving someone, like giving them a Skittle or giving them an M&M or something like that. If you have like a granola bar or something, we will, break that into pieces, put it in a container or something, and then we will use a disposable spoon or fork, whatever works better, to hand them a bite of that. You can either put it in their hands, put it on the table, they can eat it off the table. I just don't want food transferred from hand to hand. You can wear a glove while doing that or not wear a glove while doing that. But if you touch the end of the spoon or fork that they bite off of that's touching the food, you should throw it out. We'll put baggies with spoons and forks in each of the learners' bins, and we'll try to set it up that there are, containers that you can put their snacks in, or baggies, if it's easy to work with that way. But if your spoon or fork fell on the ground or it touched, something else, you should return it to the receptacle that it was in. If you don't want to set it on the table, put it back in the bin or something, and then give them another bite. If it's in the receptacle, the part that touches the food hasn't touched anything else, you can continue to use it. So, like I said, we can put the food, you can place it on the table or in the learner's hands or something. I just don't want the spoons touching a lot of things. Learners are going to be at the table, their hands are going to be on the table, their hands are going to be on the food. You can set the snack on the table, but we're going to have a general rule, but if the spoon or fork touches anything on the bite end of it, get a different one. I recommend using a clicker to reinforce with immediacy and then follow up with giving them the food. That'll help with that. So, oops, okay, let's see. All right, so how will we set up BLS to make smaller groups so that we have less contact between them? So each employee will be assigned to a specific classroom or office. So there's one office and 4 classrooms. That's totals 5 separate areas. Each of those areas will have an assigned bathroom area and a break room or lunchroom area. There'll be no crossover of employees between these areas. See specifics on interactions with office personnel, including meeting with HR, IT, consulting with me, and more. And in the case of an emergency or an instance that may lead to permanent harm, like choking, a fire, individual has fallen and broken their leg, you can disregard the division protocol, you know, and go assist by all means. But typical aggression towards other learners, self-injurious behavior, you know, typical aggression towards others by learners and self-injurious behavior and such has to be addressed with the people in the room, normally located in that room. So more on structure, employees are expected to use a lunchroom, break room that's assigned to their specific group. They're not allowed to go in another group's lunchroom area, break area. You can leave for lunch. We won't prevent you from eating lunch with someone else outside of the facility, someone else outside of your group. But we do ask that you use social distancing, wear masks if in a car together, like traveling to a restaurant or something, or if you're in a enclosed space, use social distancing if you're gonna sit and eat together. Employees are expected to use bathrooms assigned to their group and aren't allowed to go into bathrooms, into another group's bathroom. So supervisors who have desk space are asked to move their desks next to the desk of other supervisors who are in their classroom. And those desks will remain in the office area. We are kind of scooting your office over into the room next door. I'll talk more about that. Binders and client-specific materials can be kept in the file cabinets like we have been in the classrooms, in the analyst desk, you know, if you have things in there, or in the cabinet that will be located near to the analyst desk. Supervisors will keep materials at their desks and in cabinets by their desk in the office, but they will not be allowed to sit at their and work at their desks. Remember, you tend to, you're more likely to catch this or transmit it to people if you're unknowingly carrying it, who people you spend time around for a significant chunk of time. So we don't want crossover between groups and office areas. But you could travel in there to get things and keep your things at your desk. But you will have a table in the assigned classroom and that'll be used for that purpose, or any other people who need to do paperwork. iPads will be placed in each classroom. We'll have extras in there, we'll have chargers in there. We'll try to keep them in the same spot, so they're always in the same spot, but they will be collected and placed into the charger at the end of the day because they have to sync up. A laptop or a desktop will be kept in each classroom. That'll be used to make and print pictures or whatever materials you want. I'm working out specifics on printers yet, so I didn't put that in here. We may just have specific person, like supervisors retrieve things from the printer, because there's one in the office area. I have to analyze costs, and if we, you know, I don't really think we have space to put them anywhere else, so I forgot to put in specifics on accessing, getting things from the printer, but we'll probably limit it to just the supervisors who are the only ones who can go into that office area. Each analyst or supervisor will have a BLS laptop. That's the 4 people, Carissa, Leah, Rachel, and Sam will have a laptop, and they'll use that in their classrooms. Katie will use the Mac for scheduling, and the one that we had for parent training and such. File cabinets will be kept in each classroom as usual. Old binders and things like that will be kept in the lockers in the supervisor's area, but only supervisors can go in there to get them. All classrooms will be located where they were before. However, some learners will be moved into other classrooms. We have created a separate space for a few learners, so I'll talk about that in here too. Leah will be the analyst supervisor in classroom 1. Taryn S. will be filling in for Emily as classroom lead. Congratulations, Taryn S. Danny will be the float in classroom 1. We have changed some of the learners there, so that will be physically classroom 1 there, and Rachel will be the analyst supervisor in classroom 2. Kayla will be the classroom lead in there, and Carly will be the classroom 2 float. We have kind of done a physical switch between, like, a lot of the kids who were in classroom 2 are just moved over to classroom 3, and several of the kids who were in classroom 3 have been moved to classroom 2. So so Kayla went with them, and Carly will be the classroom 2 float. Carissa will be the analyst supervisor in classroom 3. Laura will be the classroom lead in there, and Holly will be the classroom 3 float. Sam will be the analyst supervisor in classroom 4. Katie will be the classroom lead, and Julie will be the classroom 4 float. We have created an additional space for some learners, and then we call it the quiet classroom. And that is located where your old break room was. That classroom is in Rachel's jurisdiction, and she will be the supervisor. The supervisor, classroom lead, and classroom float for classroom 2 will cover both of those rooms. So you'll be able to go back and forth, and the therapist in those rooms will go back and forth between those classrooms. Sorry. Okay, there we go. So the break room, lunchroom, bathroom. So again, we are going to try not to have crossover. Classroom 1 employees and learners will use half of the previous conference room as a lunchroom and as a break room. You won't be in there at the same time as the kids, and you won't be in there at the same time. Well, I'll talk a little bit more there. So you won't be in the same time. Learners will go in for lunch with employees, therapists who are on the clock. Therapists will go in there for lunch when they're off the clock. So classroom, of course you can leave if you want. Classroom 2 employees and learners will use half of that previous conference room as a lunchroom break room. Lockers will be placed along walls on each side of the room. The room will be divided down the middle, not all the way up to the ceiling, but we will just put some room dividers in there. Separate tables will be used on both sides, and you will be in there at different times. And so you won't be in there together. Each side of the lunchroom will have its own microwave, own coffee pot, and we're going to go with disposable silverware, plates, coffee cups, other cups, disposable as much as possible. It's anti-recycling, anti-green, but it's, safer, less possibility, we don't have to take things to the sink to wash them. Employees will eat lunch without clients, but the schedule isn't ready yet. Classroom 1 employees and learners will use the bathroom in classroom 1 and the back hall bathroom, that one that's in the hallway. Classroom 2 employees and learners will use the bathroom in the lobby and the bathroom in the quiet room. So you kind of got 2 decent sized bathrooms there, but you also we're gonna need that space for the learners in that quiet classroom. Classroom 3 employees and learners will use a previous activity room as a lunchroom and a break room. Lockers will be in there as well for this group. The sink in the kitchen off the gym will be used as needed, but washing hands we would like to occur, like after learners are done with lunch, we would like that to occur in what was previously called the girls' bathroom. It will just now be classroom 3 bathroom. And the lunchroom will have its own microwave, coffee pot, disposable silverware and such. Employees will eat lunch without clients, but a specific schedule isn't ready yet. Classroom 3 employees and learners will use the previous girls' bathroom, obviously, off of the gym. It will no longer be called the girls' bathroom, it will be called classroom 3 bathroom. I keep hitting the wrong side there. Okay, classroom 4 employees and learners will use what was previously the supervisor office. So up in the corner, it was our old lobby long ago, that L-shaped office. That will be classroom 4's lunchroom, break room. Lockers will be in there for this group. The sink off the kitchen will be used as needed, but washing hands after lunch should take place in what was previously the boys' bathroom, if at all possible. And this lunchroom will have, again, same thing, all those things. And the classroom 4 employees and learners will use, like I said, the boys' bathroom. Previous boys' bathroom is now classroom 4 bathroom. We're currently installing a second toilet in there. So built a little wall. We've got stall doors ordered. So there'll be 2 separate bathrooms. We wanted to make sure that every group had 2 bathrooms. The only one that doesn't is the office group, but that's a smaller group. Miscellaneous related to these topics. The large refrigerator that was previously, in the employee break room, we're going to move that to just outside the wall of the conference room that's now a lunchroom, break room for classroom 1 and 2. One classroom will have one half of that refrigerator, the other classroom will have the other half. All employees and learners will put their things in there. And there will be an upright freezer. We're purchasing a new upright freezer next to that. Again, we will divide it in half. Classroom 1 will have like one half and the classroom 2 will have the other half. All employees and learners will have their things in there. We're gonna encourage families to send less in for the freezer, to send more in a child's lunchbox daily. I didn't put it in here, but we are going to encourage families that we tell them that we will send, if they we would like them to send more on a daily basis for lunch, and we will send the dishes back. I want to minimize washing dishes, so there's just less time spent at the sinks. And the refrigerator in the kitchen off the gym will be used by classroom 3 and 4, same thing, divided in half. The upright freezer in there will divide it in half. The refrigerator freezer in the office, that kitchen area, the small one will continue to be used by office personnel, including anybody who might work as a receptionist, any additional employees who work there as well. Water dispensers will not be available in each lunchroom and break room. We will provide water bottles along with snacks. We're going to put that in employee reinforcer store. We'll have one in each area, and we'll put water bottles, but we can't guarantee that those won't be gone. Sometimes we run through those things quickly. So if you aren't comfortable drinking water out of the faucet, I'd say bring your own water bottle from home. Try to install like water, filters on the faucets. But if you're not comfortable with using that, bring water from home. And so I already talked about the snacks and such. Supervisors, you'll have a desk in the office, the central office where the printer and the iPads are stored right now. You won't be sitting in there. You won't need a locker unless you want one. If there's an extra locker in the lunchroom break room in your group and you want one, you can request it. We'll put coat racks in all of those break rooms, lunchrooms, and in that office area. I think there are some already. Learners will hang their coats in the hallway. As far as a shoe policy, I'm open to creating a more specific one, but I was thinking possibly having learners change their shoes in the lobby. They could change into slippers. They could have a BLS only pair of shoes that's maybe labeled with a privacy name, or just wear socks. Employees can do the same thing. We can talk more at the end. Client reinforcer store will remain in the same spot. The intake room will remain. The sensory room will remain, but we're going to minimize what's located in there. Living room will remain. The couch is going to be moved out, and we're going to replace those once will be cleaned. Probably taking the love seat and chairs that were in the conference room and putting them in there. The larger timeout room by the office will be used for activity. We're going to we're going to come up with how we're going to move through there, and obviously you will move through with some learners in your group. The whole group probably wouldn't. I don't know that they would all fit in there. Probably not. We might work out a schedule. And the small room, old receptive room, will be an additional room. I'm not sure what, maybe training. It's not very big. The other timeout rooms will be used. The other timeout room will be used for timeouts as needed. But we can talk more about how to use that room. Office manager, HR, intake and pre-auth, insurance and IT and such. So Becky and I will use the main office in Suite E. The human resources director, Stephanie, will use the enclosed office in Suite E. That was like the old quiet room, my faux office that I never used. That will be Stephanie's. It'll be big enough that people meeting with her can social distance, of course, also wearing a mask. And the intake and pre-auth specialist, Brittany, will remain in her office just off the kitchen in Suite E. Insurance biller, IT, Van will use the office next to Brittany's. That was previously used as like a backup quiet room when we had file cabinets. That's going to be Van's office. And those file cabinets, there's just 3 or so, are going to move into the main office area. So gym rules. So again, remember that you tend to catch the virus or transmit it to people who you spend time around, significant chunk of time around in more closer proximity. And so the gym is going to be a big area. We won't have the lunchroom there anymore. So all the way from, the wall by the lunchroom to the wall by the living room, we are going to have 6 learners and 6 therapists max allowed in the gym, and including the sensory room and the living room. A monitor will be keeping track of the number of people in the gym and may ask, encourage you to have your learner wait to come in if we're at capacity, or I'm not going to ask them to encourage people to leave, but I will ask therapists in the gym to monitor whether other people are waiting to enter. We'll try to create some sort of like a space where learners can kind of wait, like maybe along the wall in the lunch area if they come in there. Small toys can be brought out. We're going to have things in classrooms, but not left there. Like, you know, take them back into the room, and then large items will be left in the gym. So cleaning protocol. We will have someone monitoring the gym. That person is also going to assist with cleaning, but we are going to ask therapists, you know, to grab a bleach wipe. And if, you know, like if you're running after your learner, you don't have to wipe off what they played with. Like if someone's on a swing, when they get off, a bleach wipe, just quickly wipe the chains. But the person monitoring the gym will assist with that. I may have 2 people monitoring the gym. It looks like, okay. So like I said, we'll keep some things like, you know, Velcro catch, jump ropes, bean bags, things like that in the classroom. If you want to bring, if the kids want to bring those out to the gym, they can, but they have to go back after they're done playing. And then the big trampoline is being taken down probably today. We can't regularly and easily clean it. We're not getting rid of it. We're going to put it up in the attic. We're replacing it with some other jumpy toys, like this picture up in the right-hand corner, where you can kind of hold on to the handles and jump. And we'll have a new jogger trampoline that some learners may like. Those aren't as exciting, but it's a pretty good size one. And we'll have new toys like this little seated spinner that kind of works with gravity. That does have, I think, like about 160-pound weight limit. And the jumpy toys have like a 330-pound weight limit. Whoops. Okay, so cleaning protocol in the classroom. So we can't clean each toy in a classroom after each use, but therapists in a given room should wipe a toy with like a bleach wipe if a learner put it in his mouth or sneezed on it or something. We will spray the toys with Lysol at the end of the day. If we have 2 sets of learners at first, like if half come in the morning and the other in the afternoon, we'll gradually increase out. As we are like gradually increasing hours, we'll spray the toys in between those groups. And we'll wipe a learner's table with a bleach wipe a few times per day and always at the end of the day. So while wiping the table at the end of the day, we'll wipe the chair as well. Patrick won't be wiping the tables in the rooms, although he may do classroom 4. I don't want him like going into the other rooms because he's going to be in his own classroom too. Interacting with office personnel and everybody else there. So when you need to talk with or meet with anyone in the office, you should wear a mask and you should social distance. Learners should not go into any offices, and I have to determine how to interact with employees and learners in their rooms. I will likely have to use at least some video, like FaceTime or something, and I'll have to social distance and consult maybe from just outside the room. I might step just inside the room so that it can be, you know, if needed, but I'm going to try to social distance because I don't want to cross over between groups either and undo all this. So community outings, which will take, during which you take learners out, are going to be canceled for the time being, although we will take learners through drive-thrus. I think I forgot to put in here that what I will probably do is assign 1 van to classrooms 1 and 2, and another van to classrooms 3 and 4. But if you take a learner through a drive-thru, for example, or just after you use the van to run to the store, you'll just, you know, take a bleach wipe, not alcohol, because that will like, it starts to eat away at like the covering on the steering wheel and such. But take a bleach wipe and just wipe the steering wheel, wipe the handles on the door on the inside and on the outside. Anything that you touch, you know, wouldn't have to go crazy. And same thing for where the learners are sitting, wipe the handles on the inside, handles on the outside. We might send someone to the store to purchase rewards or something for the learners once in a while, and we will practice desensitization in the facility rather than going out if anybody was doing that. If there is a positive test, so if a learner or an employee in a group, in any one of those groups tests positive, all the people, the learners and employees in that group will be asked to quarantine for 14 days. After 14 days, if they haven't shown symptoms, they can return to work. If anyone in that group shows symptoms within that time, they have to get tested, they have to go to a doctor. Anyone who tests positive is going to have to be released by a doctor before returning back to work. Anyone outside of that group, anyone outside of that group that has the positive in it, will continue coming to work. This is part of the reason why we're separating into groups, is so that we can minimize crossover. The entire facility will be thoroughly cleaned with a focus on the room in which the individual tested positive spent most of his time. I'm going to just digress for a second and say that, like, I understand some people who aren't in the same group, and we have not placed everybody yet. So some people who aren't in the same group may socialize outside of BLS. And I can't tell you not to do that. I would encourage face masks when you're doing that. But by separating into groups and following this protocol, we are at least, like, we're keeping the clients separate from each other. So if anybody in their family or them ends up positive, they will be segregated. So at least we will be preventing, spread in that direction. And I realize some people might have contact. Social distancing, face masks, everybody wearing face masks is a good idea. Okay, so I'll just come back to that if anybody has questions. We will have to work with the analysts and classroom leads to determine how to set up each classroom. Learners with the MyWay protocol will not have free range of the facility. They will be able to go into the gym, and if there's availability, they can go in there without waiting. But we'll have to get a little creative, and we'll have to figure out what we're going to do if they want to go out there and they can't. But we're going to set up the classrooms, because we are going to have a pretty good amount of room in each classroom, so that we can make like a happy land in their classroom. Like I said, we can get creative. Okay. Let's see. Okay, so we will continue to have Kayla provide PCM training. She will possibly have to provide training to therapists from different groups separately. She may do the book portion over some kind of training like Zoom or such with therapists in different rooms if they're not in the same group. And when she's doing the physical practice, she might grab another therapist from that same group to assist, even if they're not up for recertification. That way that close physical contact will happen with someone that's in the same group. And we'll provide more on that soon. We have to work out the details of that. How long will we be arranged like this? And how long will we follow this protocol? So we're going to continue in this format until healthcare experts recommend something else, or a vaccine is available and most people are vaccinated. So it's going to be, depending on how you look at things, I think of that as short term, but probably more than a year. So it's not going to be a matter of weeks or months. It'll probably be more than a year. Like I said, people will be able to move through the facility. You will be able to go into the gym. You will be able to go retrieve things from, your lunchroom area, your break room area, things like that. But you will not be allowed to go into other groups' areas. And a few last things. So I'm meeting with Katie today to discuss the schedule. We're trying to be creative and flexible with scheduling. So more on that soon. I understand that there's a lot of financial reasons that that people might not want to come back to work. So we're trying to work with that. And I will let you know soon. We're going to set up another meeting soon. We'll be communicating with families soon. Some have contacted me already, and I've kind of told them I'm going to have the safety protocol on a form that I'm going to send to them by the end of this week, hopefully by tomorrow. And then I'm going to ask supervisors to help me contact them and let them know what the plan is. And we are having all the classrooms repainted, so including the old break room, and then what's going to be the lunchroom break room for classroom 4 that was the supervisor office needed to be repainted too. So that's being done. And like I said, I'll schedule another meeting. So just watch the GroupMe for information on that. So I'm going to stop the screen share and make sure Okay, let's see. I am allowing you to unmute yourselves if you would like to. I'm going to pull up the chat and go through if there are any questions. So, so Brittany, you asked, who is going to make sure that these are implemented? Are we just going to trust employees to do their part? I'm not sure what you were talking about there, but if you're talking about washing hands and things like that, I think what we'll do at first is probably have like an announcement. If you haven't washed your hands yet this hour, please do that. I will ask the supervisors in the room to make sure that people are implementing the food protocol, you know, using a spoon, things like that. Parent trainings and intake assessments. Well, when will we know what classrooms and kids we have? I hope to let you know that by early next week. So like maybe by Wednesday of next week, I certainly I hope to have that done. If not, let's say a probable deadline will be Friday of next week. What will parent trainings and intake assessments be taking place still? We will do parent trainings. I think what we will, that's a good question, and I actually didn't think that much about how those will happen. We probably will allow parents to come in for a parent training. We are going to use, like the group instruction room is going to be available for trainings. So I may do parent trainings and start them out in there, and then, you know, potentially take them into their child's classroom. Of course, they'll have to follow the protocol, face mask, wash hands when they first get there, that kind of thing, or hand sanitizer. And as far as going into their homes, that part I'm not certain about, so I'll have to think more on that. Will one toilet be client only and the other for therapists, since there will be 2 toilets? We can encourage people to use one for the client and one for the therapist, but you know, if there's an emergency or something, then we'll have to use both of them for clients as well. So we can say, you know, put a note in there, try to encourage clients to use the toilet, you know, label it, but we may have to use both for everybody. Although I will have a protocol listed in there. When you're done with the toilet, use a bleach wipe, wipe off the seat, wipe off the handle, wipe off the seat, in that order, and then throw it in the garbage, not in the toilet, obviously. So we'll ask that you do that after you use the bathroom and after the client uses the bathroom, but we'll write that up. There's probably going to be more on it than just that. I think we'll get into a habit of just wiping everything. What if we provided socks like for jump zone for them to change into with the grips on the bottom? That's not a bad idea, unless somebody won't wear them. And in that case, we could potentially have a pair of socks that they change into. I have to be honest, I didn't do a lot of research on the rate of transmission via, you know, footwear or anything like that. But I'm open to providing, I'm gonna write a note here, open to providing socks. Okay, will Lucy be handing out the car keys and medicine still? So we will keep the car keys in the same spot, and I will ask her to hand them out still. We'll give her a protocol. You know, she'll have to wear a face mask too. She can wear gloves when she gets the car keys. Everybody can, and then, you know, we can have her wipe them down and put them in the drawer when they're handed back, so they'll be sanitized. As far as medicine, Probably yes. I will still have her do that. We'll do a social distancing protocol. What I'll probably have her do is we'll have to get some kind of receptacle that she can pour the medicine in and then just hold it out, and then the learner can take that out, or you can take it out with a gloved hand. You give it to the learner. Okay. All right. So Cece, I don't know if you had you said you had a question, but you didn't type what it was. So maybe, okay, here it is. Let me go through these other ones real quick. Are we still counting on June 8th or the 15th? I know both days are brought up. At this moment, we were looking at June 8th. If we can't get everything in place in time, or if we just, for some other reason, like if the parents aren't ready to send their children back, most of them aren't ready to send them back until the 15th, then we might wait to the 15th. At this point, we're still looking at June 8th. If we are going to back it up, I'll try to have that answer by next Wednesday. Okay, so let's count on June 8th, and if that changes, I will try to give you that answer by next Wednesday. So I'm going to make a note here. I want to have placement for therapists and solid date. I would say June 8th is a solid date, but if we're going to change it to June 15th, we will do that by next Wednesday. If a client shows symptoms while at BLS, would everybody in the classroom have to quarantine for 14 days? What we will do is that we'll ask that individual to go get tested. And if they have a positive test, then you would quarantine for 14 days. So if they have symptoms, I guess I need to put that down on paper, but what I would prefer is that what I'm suggesting is that we tell them that they have to take their child to a doctor to get released by the doctor. So if they take their child to the doctor and their doctor does a strep test, he has strep throat, then they would just stay at home until they feel better and come back. If they take them to the child to the doctor and the doctor doesn't diagnose anything else, we would request that they, if they don't have some other diagnosis, we request they have a test, a COVID test, and if it comes back positive, that is when we would do the quarantine. That's, I think, standard procedure. Someone correct me if I'm wrong. So we won't quarantine until there's a positive result, so not just based on symptoms. But we would ask that if the doctor says, oh yes, you have strep throat, or you have sinus infection and there's drainage going down your throat, here's some antibiotics, the doctor will make the call there on whether the test. But if they don't, so we'll set that specific protocol up. Will we be able to talk with supervisors about behavior plans prior to returning? What we'll probably do is set up a meeting with the individuals who will be in that classroom, with the supervisors in that classroom. And so yes, we'll do that. Group instruction. We are not going to be doing group instruction right now. We will be doing group responding in the classrooms. So yes, we will not be doing group instruction right now, but we will be doing group responding. So anybody who is a group instructor could be involved in that. Is Pat going to work 3 days a week? Is he still going to work 3 days a week? He has been going to WinStar. He has been still going to WinStar. I probably will continue to have him do that. It's definitely something he can social distance at. As far as the other ones, I am not sure if we will have him go to the office or not. We haven't been doing that. So he will go to work 1 day a week for sure. And as far as anywhere else, I'll have to get back to you on that. Any idea what days and hours we are going to be open? So I am meeting with Katie this afternoon to start looking at scheduling. We're trying to start with part-time for the therapists and the learners. I think that the learners, we're going to, you know, we'll talk more with your supervisors, but the learners are going to enjoy probably coming back, most of them. They're going to have a lot of fun. We're going to make it a lot of reinforcement. It's just going to be harder for us because, you know, we aren't just going to be there to have fun. We're going to have to, monitor learners and implement behavior plans, but we're going to start really ease back in. So more on that in the next meeting. If we live with someone who works in a hot zone, are we still going to be able to continue working? So if you if you aren't showing any symptoms and the person you are living with isn't showing any symptoms and hasn't tested positive, then I would say yes, you can continue working. So if anybody you live with shows any symptoms, well, anybody you live with has been diagnosed through a test or has been diagnosed by a doctor via symptoms, but they've been diagnosed to be probably positive, then you should quarantine. If that hasn't happened, then you can continue working. What are we doing about clients who have the My Way protocol? Will we still be implementing that? I didn't give a lot of detail on that because we have to work it out. So we will be implementing a My Way protocol, but we will not be giving them like free access to the entire facility. They won't be able to go into other classrooms and things like that. But we will try to set up an area in their room and allow them to go to into the gym so that they can access, we're trying to really work harder to make an area in their classroom happy land for them. And we will have to, though, say no to things like going into other classrooms, other like rooms that would be other lunchrooms, break rooms for other groups. And if the gym is full, they will have to wait. And so we'll have to plan for that. More on that when you get with your supervisors in smaller groups. Do we know what clients will be in each room? Also, what about implementing PCM? We do know what clients will be in each room. I would rather go over that in the next meeting. What about implementing PCM? So with PCM, we'll have to use the people who are in the classroom to implement PCM. We're going to try to minimize the need for that. And if that means changing the behavior plan some way to do that, we will do that prior to opening. Or just as we are opening, we can modify it as we go if we need to. But so we are going to try to minimize the need for that. That may mean implementing something like a My Way protocol with some other learners. Will we be getting rid of sensory bins and getting new ones? Well, I don't really think we need to get rid of them unless they're kind of, need to be replaced because they haven't been touched in so long now. There's no virus on them, but we will move those into the classrooms. So they will be, in their own classrooms. So we won't have like community ones. They will have to be in the classrooms. And once the schedule is put together and everyone knows what room they will be in, can we come in a day early and see the layout of the building? Yes, you can come in a day early. I am going to actually schedule a little bit of time for people to come in and, set up for the kids in their classroom. And also I may ask some people who want to come in and help organize and things like that. I'm going to ask for ideas on how to do that. We're going to divide supplies up between classrooms and things like that. So we will schedule something like that. And for people who help get multiple lunches ready, they should have to change their gloves once they're done touching one family's lunchbox and then food before making another. Yes, definitely. And so we will each have our own lunchrooms. Each group, there will be 4 lunchrooms. So that group of people who are going in, that group of learners is getting much smaller. So it's much more, I think what we'll probably do is just have the therapist who's with the learner prepare, or a supervisor or somebody who's helping them, you know, depending on how needy your child is. So we won't have to have, you know, lunches being like prepared and just like, you know, conveyor belt system kind of thing, because it'll be smaller groups. But yes, you should always change your gloves between preparing anybody's lunch. And if you do something else in between and come back to helping somebody, you should change your gloves. RTC is taken into consideration when assigning employees to classrooms, or are employees going to be assigned and not worry about TC stuff until we are settled and more full-time? We are taking into consideration TCs. We have not, I'm talking with supervisors. And so we are definitely taking that into consideration, but I can't guarantee that you will be placed in a classroom for a learner or both learners that you are a TC, because we had to place the learners in a way that worked and that also allowed for a minimal transition among their, you know, supervisor. And so we will take that into consideration. Do we know what clients will be in each room? Okay, I will give you that information Wednesday. Will the responsibilities of the floats be changing, or still just filling in for therapists when they're out and helping with crisis? I mean, your responsibilities may change a little bit, but you will continue to do that. Responsibilities will probably change a little bit, like some of the responsibilities maybe that TCs had before, we'll ask the supervisors in the classroom to help a little bit more with. And that all depends on scheduling and things like that. Friday morning meetings. Yes, I am debating what to do about Friday morning meetings. What I am thinking, what I will probably do, we'll continue to do those, but people will go into their classrooms or maybe into their break room, lunchroom area. Well, probably their classrooms. And we can do it via Zoom. That might be something that we can do, so we can do it all together. But that is probably what we'll do. But I don't think we're going to be doing Friday morning meetings for a little while. So when we resume them, though, we'll do something like that. So I got to the last of the questions. Someone asked, is anyone at BLS right now? No one is there right now, but I am going there. I will be there actually probably by 12:30 or 1. So, and I'll be there until probably around 5 o'clock, maybe later, but I can guarantee I'll be there till about 5 o'clock. So if anybody wants to come over there. Okay, so we are going to be, a couple other things. We are going to be giving t-shirts out to people who come back, you know, right away. And we're gonna do 4 t-shirts. The first t-shirt is going to be, it's going to say BLS on the front and then Stronger Together on the back. The second t-shirt, oh gosh, okay. I didn't write it down here. Want to make sure I get it right. The second t-shirt is going to say on the front, be present in the moment. I think it's going to say BLS, be present in the moment. And on the back, let feelings be there, stay in touch with your values. So that's BLS, be present in the moment, let feelings be there, stay in touch with your values. Exactly how we'll lay that out on the shirt, I'm not 100% certain, but, and then the third shirt is going to be sort of like a Scrabble board. We're gonna have the word autism somewhere on the front, and then we'll have words going up or down or across that are related to BLS, autism. They don't have to start with or end with the letters in the word autism. That could be in the middle somewhere, but we'll have to figure it out on the layout. They could intersect with other words that are on there. So I am asking for suggestions on words that you think should go on there. You can text them to the group or you can text them to me. And then the fourth shirt is going to be a word bubble. So we're going to create like a survey with a number of words on there. We're going to have you guys vote for like your top so many words that you think describe, you know, what you do, ELS, you know, the clients you help, things like that. We'll have words, then you can vote on them, and we'll probably give you an option to suggest one too. So then we'll make a word bubble. You know what those are. The size of the word depends on how many people picked that word, and that'll be the fourth one. So we'll have to do that pretty quick so we can get those ordered. All right. Well, we are done. If you want me to email you this presentation, then please put your email in the chat box. And if you don't get the opportunity, you could also put it in BLS. You can text it to me at 742-2803. You can email it to me, your email, or you can put it in the chat box here. My email, the easiest one is just jillrevere@gmail.com. So, okay, well, I'm gonna go ahead and end, and just let me know if you would like.
So there's 2 more questions in the chat box.
Oh, okay. Will we not know our schedules until next week, like part-time or full-time days instead of, yeah, I won't have that ready yet. Like I'm starting to work on it today. I'm trying to be flexible and make it work out for you guys. But I definitely won't have the schedule until at least probably, you know, the end of next week. So do we have a start time and end time for the workday for preparing for childcare? Well, we're trying to work it out where you guys can do childcare. Do part-time, and so that's why I'm starting to work on the schedule today. Meeting with Katie is so that I can get that to you as quickly as possible. So if you end up working like mornings a couple days a week and afternoons a couple days a week, I want to get that information to you, but I don't have that yet. And so I'm sorry, but I'll get that to you as soon as I can. When will the next meeting be? So I was thinking we could schedule another meeting. We could do it Wednesday of next week, like Tuesday or Wednesday of next week. Let's see. I think just for simplicity, if we could just do Wednesday, 10 o'clock next week, that would be like nice and consistent. And I would just like to do it again on Zoom. So I can create another invite. So Wednesday at 10 of next week on Zoom, I'll create another invite and send it to the group message. Also, I am going to do another behavioral relaxation training. And I was going to do that. I was going to do one tomorrow at 4 p.m. So tomorrow, Thursday at 4 p.m., I'm going to do a behavioral relaxation training. All it is I just kind of coach you on going through and relaxing different parts of your body. You can be just like this. You can be watching, but not be on video or audio. So you're completely anonymous. And it's very much like meditation. You usually feel very relaxed afterward. A lot of therapists have done it. I did these sometimes in the past at Friday morning meetings. So if anybody has done one and recommends it, maybe send a message to the group me. I think it's just a nice way to help, just relax your body, relax your mind. So I will do that tomorrow at 4 p.m. I will send the invite. I can send it to the group message, but I can also send it to you directly in your email if you like. just send me a text or send me an email, and then I'll send you that invite. And I think that's it. So I'm going to go ahead and log off. So we'll have another meeting. We'll have behavioral relaxation training tomorrow at 4 p.m. And then we'll have another meeting like this next Wednesday at 10. All right. So I'll talk with you guys again soon.